Hey, today we are going to do an awesome exercise routine that specifically is meant to help with knee pain. So this is what I give to my clients and my physical therapy patients to help if they have chronic knee pain. So this should help prevent pain and help prevent it from coming back in the future. So all you need is a mat and then a squishy ball, like a playground ball. If you don't have one of these, no problem. Just grab a pillow and have it close. We're going to use it in a little bit. So swing around and have one leg straight and one knee bent. So this is called a quad set, and this is what I want all of you to start with. Have this leg straight out, pull the toes back towards you, and what you're gonna do is tighten your thigh muscle here. That's it. So you're gonna squeeze and tighten. Your foot might even lift off the ground a little bit, and I want you to hold it 10 seconds, and then relax. And then you're gonna do it again. Squeeze and hold it 10 seconds, and breathe, and then relax. So if you need to, you're gonna pause this video and I want you to do 10 of these on each side, okay? So 10, where you hold it 10 seconds, then relax, and then do the other leg. Even if you only have knee pain on one side, I think it's best to do both sides because it's very common to end up having a problem on the other side. So go ahead and you might as well help prevent it now, right? So a quad set might seem very simple, I know, but don't skip this part. You are retraining a really important little muscle right on the inside of the kneecap that tends to kind of get tired and stop working when you have knee pain. So if you go straight into heavy squats just because you want to push through it, that's not going to kick that muscle. It's called the VMO. That's not going to kick that in. So you want to do some simple things like this to really remind it to work, which is what's going to help your knee pain when you're doing squats and lunges and those kind of things. So don't skip this part. Pause the video, do these throughout the day. You could do up to 100 during the day, just whenever you think about it. Okay, so that's your quad set. Next exercise, you're going to lean back and we're going to take this into what's called a straight leg raise. So tighten the muscle again, that's the important thing. Tighten it and then lift the leg, just nice and slow. Lower it back down and relax. So you can either do it up here or sometimes it's a little easier down on your elbows. So tighten first, keep the knee completely straight. I actually want it locked, so completely straight and locked, lower. So I have another video for knee pain out, and some of these beginner exercises are the same. And then I'm just gonna progress it from here, but I don't ever wanna skip these really simple ones. And again, do it on both sides. So I won't go through all of them with you, but do 10, and then 10 on the other side. So pause me again. Pause, and then come back after you've done 10 on each. Okay, so this is just our beginning part that I want everyone to do to get warmed up and really train that muscle. Super, super important. And then we'll all meet back here. Okay? So once you come back, lay down on your back and bring that pillow or ball with you. So if you have a pillow, just fold it in half. And then we're going to put it in between your knees, okay? So you're here lying on your back. I want you to take an inhale, and then exhale, curl your tailbone, roll yourself up into a bridge. We're going to do 5 of these. Inhale at the top, and then exhale, roll back down. So I really want you to focus on rolling your back one vertebrae at a time. And you might think, what does this have to do with my knees? Well, what we're doing is, one, we're working glutes and hamstrings. Super important when it comes to knee stabilization. And then 2, we are stabilizing your pelvis. Again, really important. So I will tell you from experience, a vast majority of people with knee pain have some weakness in the pelvis and the hips. So I really work a lot on stabilizing and strengthening that. And then the final piece is actually getting your spine moving, because that's kind of a missing link sometimes that people don't think about with knee pain, is a lot of it can come from the back not moving properly. So that's what bridges are going to do. They're going to kind of cover all 3 of those aspects. All right, so let's roll up and stay here. And what you're going to do is squeeze the ball. Squeeze, release, squeeze, release. Again, pillow is great. So inner thighs are working now and still strengthening glutes and hamstrings. Let's do 4, 3, 2, 1. Roll back down. We're going to do it again. Inhale. Exhale, roll up. Now this is going to be a little bit harder. Keep the ball. Straighten your right leg out. Lower it down, and I want it slow like this. left leg, and down. Same thing, right leg. So your number one goal here is not to let the hips drop. And if they do, that just shows you that one hip is weaker than the other. So you want to keep your hips completely level when you do this. And if this is too much for you, then just go back to the ball squeezes and then jump into this next time. Okay, last one. Good, stay here, inhale, and then exhale, roll yourself back down. Nice job. All right, let's take the ball out. Just a little more for glutes and hamstrings here. I'll get that out of the way. So keep your right leg where it is. Your left leg is going to come right here to tabletop. Now what I want you to do is lift, lower, and lift. So again, a little more glutes, like I said. Trying to keep the belly still pulled in. So you'll see the beginning of knee strengthening and stabilization isn't jumping into squats and lunges. Now, I love squats and lunges. I do them all the time, but it's because I have this foundation of healthy and stable and balanced knees and hips, so I can do them without pain. Good job. Let's switch sides. Left leg down, right leg up. Good. So just make sure if you are having knee pain that you don't jump into those really big movements and just keep pushing through the pain. That's actually not going to help. You want to find what the culprit is, address it, and then go back and do those fun things without pain. All right, let's do one more. And down. Nice job. All right, we're going to roll onto your right side. All right, so we're going to start with clamshells. You're going to have your knees bent, hips are stacked, shoulders are stacked, and you're going to lift just your top knee up and down. So we're working now your hip abductors. This is your gluteus medius. So it's helping to strengthen, again, outer hip, and it's also helping to strengthen your low back. So try to relax your head. Relax your neck. Let's do two more. Good. Lift it and lower, and then now straighten the leg out. Flex your foot. All right, this is a little different. You're going to bring the leg forward and then point to bring it back. Inhale forward, exhale back. So this is a specific Pilates move actually, and I love Pilates for helping to get that pesky outer thigh and hip stabilization. It works so many different muscles, so I really love it. So what you're trying to do is keep that leg in one line. Don't lift it up or down. And you'll see I'm doing all of these slow, and that's on purpose. I just want it to be controlled. Okay, we're going to take it into a circle. Keep your toe pointed. Come up and around. And again, when you come back down, just come to hip height. Don't let that leg come all the way to the floor. We're going to do just 6 of these. So think long leg, and then think long sideways too. And now let's switch directions. Up, forward, and then go back to that idea of the quad set that we did at the very beginning. Keep that thigh muscle super, super tight the whole time. Don't let the knee bend. I want that thigh turned on. Okay, last one. Good, stay here, little pulse, little. 8, 7, 6, good job. 4, 3, 2, 1. Very nice. You can grab the ankle. Maybe give your booty a little love slap there, and we'll switch sides. So come to your other side. So stack your hips, stack your knees, and when you're ready, lift just the top knee for your clamshell. You're only lifting the knee as much as you can that the hip doesn't roll back, right? So if that hip rolls back, if you end up like that, then you're just lifting the knee too high. I just want to keep it right in that outer thigh booty muscle. So we're going for 8 to 10 of these. I tend to lose count, so just even yourself out. 2 more. Last one. Good. Straighten the leg out. Flex your foot, and then inhale, bring it forward. That's going to stretch your hamstring a little bit. Then point and sweep it back. So So I don't go much farther back than just my body line because my back arches if I do that. So I'll show you what it looks like. For me, it looks like that, which we don't want. I want you to keep that back flat. So it's whatever motion you have that you can keep your back flat. Inhale, flex. Exhale, point. And then we're going to take it into a circle. So keep the toes pointed, come forward and up and around. And you'll notice too, I'm not letting my side waist get smaller. So that would look like this. That's too big. Again, keep it just in the leg by only letting the leg move. Bigger isn't always better. And then switch directions. Sometimes, but not always. And everybody's going to look a little different. So it's whatever motion, like I said, that you have. Remember, tighten that thigh. Keep it really, really tight and strong. Last two. And last one. And come here and pulse. Pulse. 7, 6, 5, 4, 3, 2, 1. Good. Bend the knee. Give it a little stretch. And then roll onto your back. And let's do a figure 4 stretch here. So cross the left ankle over the right knee. If this is enough, stay here. If not, pull the legs in towards you. You can hold either behind the right thigh or on top of the right shin. And then once you're there, get that tailbone down again. And breathe. And then switch legs. So cross ankle over knee or thigh. And then uncross, hug both knees in, and then roll to your side and push yourself up. Great job. So now if you have a foam roller, go get on that as well. That's a great thing you can do also is foam roll those IT bands out. So you guys did awesome. Thanks for coming by, and I hope your knees feel better. Talk soon.